Hey everyone, welcome to Virtual Vegfest Live, and we're pretty excited today because we have Dr. Michael Greger. And yay! So he'll be up in just a second. I just want to say thank you to plant-based fans and remind you that the Plant-Based Network is a partner of Virtual Vegfest and that you can shop on virtualvegfest.com. But I don't want to take up too much time talking about me. I can do that at the end. Let's just bring Dr. Greger on right now. Hey,
Let's
Dr.
do
Greger.
it.
Yeah.
Ta-da!
Look, you can hear me, and I can hear you, and I can see you.
Concept.
That is fantastic. Well, just so everybody knows, if you have any questions or you have any comments, please feel free to share them, and I'll definitely let Dr. Greger know what they are, and we can answer them. But until somebody else comes on and says, hey, I've got this to ask or whatever to ask, I have some questions that we actually got back in May. So the first one's a little benign, but Jill Trufant said she makes steel cut oats every day for breakfast, and she adds ground flax and she cooks it together. And she wanted to know if no dogs don't do that. She wanted to know if the nutritional value of the flax was impacted by cooking it, or if she should add it afterwards.
Do whatever she wants, cooked, uncooked, as long as she's getting her flax. Although one recommendation I would make is to up her game even more and move to oat groats, which are uncut, which is what they are before. They are cut with steel. I think she'll be very happy.
Oh, that's awesome. All right, that's great advice. And then Jasper Wilkins, who works with the Plant-Based Network, asked a couple of questions, and I kind of changed them up a little because they're more applicable. We wanted to know your top 3 tips for staying healthy during the pandemic.
Distance. You can't get the virus unless the virus can get to you. Where does the virus come? Comes from other people, so you stay the hell away from other people. Boom! That was easy. In fact, wearing masks may actually do more harm than good because it can make lull people into a false sense of security, and they may put themselves in an indoor, crowded, poorly ventilated space when they wouldn't otherwise, and they can be infected because of it. Stay away from people if you don't want to get the virus.
All right, well, that's great. And if people obviously are staying home a lot, and for me, this has been a really, really healthy time. I've completely improved exercise, what I'm eating, the whole thing. I've turned it into a positive, but that's what I tend to do with situations that could be considered extremely negative. For my extroverted friends, completely different story. I'm more introverted. I just took this time and said, I'm not going to waste it. So Healthwise, whole foods, plant-based, doing more of that, and that's great. Outside of just distance, is there any advice you would give for people with actually Healthwise?
Well, they should do what you're doing. They should take advantage of this time to get on a good sleep schedule, to reduce their stress, to start an exercise program, meditation practice, staying connected, albeit remotely, with friends and family, and eating a healthy diet.
Exactly.
Right? You're not going out to eat as much anymore. Fantastic. You have control over your diet. And so let's make it healthy.
That's exactly it. Eating out is just, with traveling with the events, which you were going to be part of, we would have eaten out a bunch. Sure. But that is off the table, so we hardly ever eat out now. And cooking, there's so much cooking. There's so many more fruits and vegetables in my home. Right. Because of that, and because obviously I take the time to prepare different dishes most of the time. I have some favorites. But then, let's see, you also want to know, positives of health because of the pandemic. And that's what we're talking about right now. If you took the time to exercise, took the time to change your diet, took time to get better rest. These are all things that were brought up in Code Blue, the movie. Right?
Think about all the risk factors for a severe course of COVID-19. High blood pressure, diabetes, heart disease, and obesity. In fact, even just being overweight. So having a BMI of 28, which is about being 175 pounds to the average American height, puts you at nearly 5 times the odds of a severe course. The average BMI in the United States, 29. So you could be skinnier than the average American, still have so much excess body fat to put you at significantly higher risk. But look, it's been like 7 months. right? If you were overweight 7 months ago and you would have used this opportunity to take care of yourself, you'd be in a much better place now. It's never too late to start eating or living healthy.
100% agree with you. Now, there was something I watched of yours, and this is going to be funny because it's a little thing that I brought up this week. You had posted a video, somebody posted on my face on his Facebook, and it was about pooping. Of all the things in the world to bring up. But one of the things I've thought about getting is one of the squatty potty things.
Uh-huh.
And you completely said, nope, doesn't work.
Yep.
Lack of words.
Well, no, it's not. I didn't say it. That's what the science says.
The science says. Exactly. You know, I mean, you would think that it would kind of make sense, especially if you go to like Southern Europe and you've got to squat to go to the bathroom because there's no toilet because it's a hole in the ground, right? But it's incredibly uncomfortable for women. For men, it's a little easier. But, you know, you would think, I mean, I watched it on Shark Tank, right? They did the whole thing. And I was thinking about getting one. And then I watched that video that you have up on nutritionfacts.org. And I was like, oh, nope, don't need to spend the money on that.
Anytime you want to waste your money on something, see if there's a video on nutritionfacts.org first.
That's awesome. So tell us more about nutritionfacts.org for those who don't know what it is.
Nutritionfacts.org is a free, nonprofit, science-based public service providing daily updates on the latest in nutrition research via bite-sized videos. There are more than 1,000 videos, now 2,000 now, on nearly every aspect of healthy eating, with new videos and articles uploaded nearly every day on the latest in evidence-based nutrition. What a concept. Nutritionfacts.org. Check it out.
Oh, definitely. There's stuff. I mean, it's one of the go-tos for people to say, well, I'm interested in becoming vegan or eating more plants or just getting healthier. And it is one of the things that we can share with people is go check out nutritionfacts.org if you have a question about this or that. Just any questions, you can get answers to them. Between you and Neil Bernard, you've got it covered.
Sounds good to me. I'm a big fan of Neil's work.
Exactly, that's PCRM. So those are the two go-to websites that we can share with people. And that just pretty much if you just go answer any of your questions if you just don't want to get it from somebody else. So that's pretty neat too. And then let's see, Plant-Based Network. You're part of it now, right?
I do not know.
I'm pretty sure there's something. I have to talk to Ron that something on nutritionfacts.org is going to be part of the network.
Great.
Yeah.
Well, anyone is welcome to any of the content. I just want to get out there and save some lives.
That's wonderful. And we thank you for that too. So, does anybody have any questions for Dr. Greger? That would be awesome. You can put them in the comments so we can get to what you have and what you want to know besides what I'm asking him. So I know there's a bunch of people watching and they could be from all over the world. So please write your questions or comments in and we will definitely get to them. But so, Dr. Greger, this COVID thing has really messed with the lively in-person events. And you just said distance to avoid getting the coronavirus. But when do you think we'll be able to get back to doing this in person?
Well, settle in, get comfy.
We're
going to have a workable vaccine for the general population until second half of next year. So, yeah. Get comfy.
Get comfy. And then with that vaccine, obviously there's a lot going on politically and personally for a lot of people in regards to a vaccine. Personally, I'm not interested in taking the first draft of a vaccine. I want to wait and see what happens with it, especially if one comes out this year, because maybe they didn't do their full due diligence to get it out so quickly. But what are your thoughts on like when someone should actually take that, or who should be the first people to take a vaccine?
It's not going to be out this year, so you don't have to worry about it.
That's good.
Well, yeah, no. First, it's going to go to first responders. It's not going to hit the general public first. It's going to hit those at highest risk. And so we're going to have data, real world data, out in the world before it's even a possibility for you to choose. And so we'll have there's about 100 candidate vaccines right now, and we'll get one that's safe and efficacious and get it out to the world.
All right, awesome. And that's a little scary. I mean, I'm glad that you're saying that there'll be data available before the general public will even be offered the opportunity to put this into their bodies. Because I think that's one of the concerns a lot of people have right now is, well, what's it going to do? How are we going to know if it's going? Are we going to just put it into people and they're just going to die, and then we kind of go, okay, that doesn't work?
What it's going to do is it's going to protect you from the coronavirus.
Right. That's exactly. But I mean, I guess the concern that people have is that will it work? What are the side effects of it working? Or not working? What are the side effects? What could happen to my body if I put that in? Believe me, I'm not an anti-vaxxer. So
yeah, no. The FDA is not with so much attention, laser focused on this issue. There's going to be nothing but full data transparency. The FDA is not going to release a vaccine that isn't safe. Okay. Now, I wouldn't take the Russian vaccine right now or this Chinese military vaccine. Not because they're not necessarily safe, but they haven't released the data. Like, we don't see data. In fact, it doesn't seem like they even really have much data. I mean, that's concerning. That is not a vaccine I would take. Show me the data. Any vaccine approved by the FDA, we will have the data.
All right, good. And I think that'll help go a long way, especially in the vegan community. As you know, there's different factions that feel different ways about different things, and vaccinations is definitely one of them because you go into the testing on animals and it's not vegan, but saving your life is also incredibly important. So we do have a question from Katie, which says, what are your thoughts on food combining? Is it important? Can you have something like oats immediately prior to a smoothie, for example?
Hello, Katie. Eat whatever kind of food, healthy foods you want in any combination. There's nothing you have to worry about combining wise. Eat your fruits and your vegetables together. God forbid. Oh my God. These crazy food combining rules were made up by, there's a famous book called Fit for Life by the Diamonds, and just came up with all sorts of kooky stuff, none of which is based on science. And it doesn't even make sense. Like, how would we have evolved that somehow it's better to eat fruits apart? I mean, come on. That doesn't make any sense.
Okay. Hopefully, Katie, that answers your question. It's interesting because there's so much information that's put out there about food, when to eat food, combining food, types of food. Like, you shouldn't eat pasta and rice in the same day.
It doesn't make any sense.
Right, because
it doesn't make any sense.
Because it's a matter of calories in, calories out, and to eat the healthiest foods possible. It's not high in fat foods, not high in sodium foods, but actually eating healthy whole foods.
Sounds good to me.
And it doesn't matter what time of day you eat them either, right?
Oh, it does, though.
It does? Okay, tell us.
It does have a whole chapter on chronobiology and how not to diet. Check it out. Food eaten in the morning is healthier than food, even the exact same food eaten at night. We should not eat after sundown, after 7 p.m. More we can kind of shift our calorie intake towards the morning, the better.
Oh, how interesting. So the night owls who wake up later, I guess their morning is their morning, so it doesn't really matter what their morning actually is. It's just when you wake up.
Nope. It actually matters. It's your circadian rhythm.
Okay.
And so, so it depends when your body temperature bottoms out, usually about 4 a.m., but it doesn't matter activity. It doesn't matter, like shift workers. Morning is morning. Even if it's when you're about to go to bed. So you still not eat at night. and you should eat during the day.
Oh,
Particularly,
interesting. Okay. No, I mean, I'm a late person, so I tend to have popcorn every single night, somewhere between 11 p.m. and midnight, because
have that popcorn between 6 p.m. and 7 p.m.
I haven't even had dinner yet. It's the different schedules, but I totally hear you. If I could get to you, the one thing you said was get your sleep. Definitely get your sleep, but get your sleep on some sort of schedule.
Yeah.
Not so good on my end.
Well, it's important.
I agree. It is actually important. And, we all have to work on the things we have to work on.
You're doing good things in the world. We want you to live a long, healthy life.
Thank you. And I agree 100% for you and for everyone watching as well. So you shared with me that you're in Hawaii now.
I am 5,000 miles west of you.
Which is pretty awesome because you're in a paradise that has some of the best fresh fruits in the world. And
unfortunately, we are not mango season. We missed mango season, but next year.
Oh, definitely. And pretty incredible. So, look, Katie has another question. Let's see what she has to say, because it doesn't matter what I have to say. What are the most important vitamins for a plant-based toddler to be consuming? Can they get them all through their diet, or would they need additional supplements? That's a good question, Katie.
Vitamin B12, critically important at all stages of the life cycle for anyone eating a healthy diet. I just had a B12 webinar where I have a breakdown on exactly how much kids need. They can certainly get it through breast milk if the mom's supplementing. Otherwise, they do need to get a regular, reliable source, and so that would be B12 fortified foods or B12 supplements.
And the best, and for a child, even for young children that are eating a plant-based diet, supplement with B12,
Everybody needs B12.
I mean, obviously the younger they are, like I use a sublingual every day. Yeah. So a young child, would that be the best thing for them? Or there's gummies,
there's
right?
Chewable, there's gummies, there's sprays, there's all sorts of stuff. Yeah, there's even B12 toothpaste.
Really? That's so interesting. I haven't seen that. All right.
Get absorbs right through your mouth.
Exactly. It's the idea of the sublingual. It's better to do that than take a pill, right?
As long as you're chewing it, it doesn't really. You don't have to let it dissolve in your tongue. But the reason the sublinguals are good is because they're chewable, and it needs to mix with saliva for optimal absorption. And so, as long as you're chewing it, mixing with saliva and swallowing, you're all set.
Oh, awesome! And your thoughts on vitamin D?
Vitamin D is the sunshine vitamin is critically important to get. You can get all you need with sufficient midday sun, but for those of us not getting enough sun, you need to get it from somewhere. And so if you're getting insufficient midday sun, 2,000 international units of vitamin D3 every day. If you're not getting between 10 to 15 minutes on forearms and face, between 10 and 2 at the right latitude, at the right season, if your skin is light enough, if you're young enough, if you're skinny enough, there's a lot of factors that go into adequate B12. But if for whatever reason you're not getting enough sun, you need to get D from somewhere.
Okay, awesome. So Pete Donofrio is asking, are you going to have a How Not to Diet cookbook?
I am. What a great question. I didn't feel like that was a planted question. This December, in but a few months, we have a How Not to Diet companion cookbook. Great for everyone on your holiday wish list. All proceeds donated to charity. Check it out. It's delicious.
Oh, favorite recipe?
I'd have to pull up the list. There's all sorts of amazing stuff in there.
Oh, fantastic. Oh, there you go, Pete. There's your holiday present either to yourself and to others or both. So that would make it easy. And you could buy it online so you don't have to go and see anybody. And Katie's back with her. Is the B12 webinar available online for replay?
It is indeed. You can download the whole thing in one. So if you just nutritionfacts.org. There's a resources tab up at top, and just go down to webinars, and you will see it in the list.
Oh, fantastic. And Pete said awesome to the cookbook. You know, can you share a little bit more about the books that you have out there with somebody who knows, think of it as somebody who doesn't know anything about you?
So best known for the book How Not to Die, and then there was the companion How Not to Die cookbook, and then along came How Not to Diet, talking about weight loss, and there'll be a companion cookbook coming out this year, and then just came out with How to Survive a Pandemic, last week? Next book, How Not to Age on Longevity, will be out December 2022.
Wow. So the pandemic book, you must have written that pretty quickly.
I certainly did, but I had my schedule cleared because I was going to be on the road doing 200 cities.
That's true.
And everything fell apart at the beginning of March, and all of a sudden I had a clear schedule. And so what do you do when you don't have anything to do? You write a book.
Oh, fantastic. What's in that book? Because I didn't even know you had that. So what's it? It's like really cool.
How to Survive a Pandemic. I try to cover everything there is to know to protect ourselves and our families from the coronavirus. But the best way to survive a pandemic is to prevent it in the first place. And so the bulk of the book traces the origins of the COVID coronavirus and what we can do to prevent even greater infectious disease threats in the future.
And what is the best way? I know the answer, but what is the best way to prevent these pandemics from happening again?
We need to accelerate the movement away from animal agriculture. When we overcrowd thousands of animals in these cramped, filthy football field-sized sheds to lie beak to beak or snout to snout atop their own waste, it's just a breeding ground for disease. So there's the sheer numbers, the overcrowding, the stress crippling their immune systems, the ammonia from the decomposing waste burning their lungs, lack of fresh air, lack of sunlight. Put all these factors together, what you really have is kind of a perfect storm environment for the emergence and spread of so-called super strains of influenza. The bottom line is it's not worth risking the lives of millions of people for the sake of cheaper chicken.
100% agree. Thank you so much.
For those of you who don't know what I'm talking about with bird flu, that is on the CDC's list as the leading candidate for the next pandemic after COVID-19, a bird flu virus known as H7N9, which is 100 times deadlier than COVID-19. Instead of 1 in 250 people dying, it's 40% of the people who've gotten H7N9 have died so far. Last time a bird flu virus jumped species and triggered a pandemic, it caused the deadliest plague in history, the 1918 pandemic, which killed 50 million people. That had a 2% death rate. What if we had a virus infecting billions where death was closer to a flip of a coin? But the good news is, there's something we can do about it. Just as closing down the exotic animal trade and live animal markets may go a long way towards preventing the next coronavirus pandemic, changing the way we raise domestic animals for food may help forestall the next killer flu.
And the main question, and this is the hardest question, and it's come up a lot for so many things right now, is how and why? Like, why? Why is this still happening, and how do we change it? How do we get those industries to understand that, we got to take away your money because that's why you keep doing what you're doing in the most efficient way possible that you feel.
Well, these same companies are now innovating us out of this precarious situation. Tyson, Smithfield, Hormel, Purdue, largest meat packers in the world, Cargill, all are coming out with these plant-based meat alternatives, entire lines. Cargill, the largest private corporation in the country, is now partnering with Kentucky Fried Chicken to make plant-based chicken nuggets throughout China, right? This isn't like Tofurkey anymore. These are like the biggest meat producers. They're thinking of themselves more as protein companies than meat companies, and they're the ones really leading the way to provide the same taste, cost, convenience as animal-based foods, and basically making animal agriculture obsolete.
And the best way, and we'll go into a business part of this, the best way to get them to put more money in their budget for the plant-based options, the vegan options, the plant-based meats, is to buy them, is to spend the money with these corporations that I know so many people, so many vegans hate. Like, they hate them. But I have Smithfield's plant-based meat in my freezer. But I did sit with it in the store and look at it and go, do I want to give them money?
If you don't, you're voting. It's your vote.
Yes.
Who you want to vote for, right?
Yep.
Yeah. Have you tried it yet? I haven't tried their stuff yet.
I have. It's okay. I prefer Beyond, but the fact of the matter is it's in Sprouts in the meat section, in the animal meat section. And Whoa. It just, I saw it online. I saw a guy online in front of me, and I looked at what he had. I was like, oh, this guy's buying sausages. And I looked and I said, it says plant-based. I said, wait a second, what is that? And where did you find that in the store? And he goes, oh, it's back in the corner with the other meat. And I was like, wait. And I thought there might be egg in it, because they do that. But and I was like, this is vegan. Oh my goodness. Okay, wait, bye.
Yeah, no, and that's where it should be. It's like the dairy case. You don't have to go to some special health food section to get almond milk or soy milk. It's sold right where milk is sold. And that's why major dairies in North America are going bankrupt, because you give consumers a constellation of new and better choices, and that's what they choose.
Exactly. So we've got another question, and Katie is asking, any tips overall for raising a vegan baby?
Give them lots of love. There's some wonderful books out there. Anything by Brenda Davis, Vasanta Molina, Reed Mengels. There's wonderful resources out there towards raising healthy, happy kids.
Fantastic. Thank you for that. Now, Dr. Greger, if somebody wanted to buy your books, we know nutritionfacts.org, but if somebody wanted to buy your books or learn more about you or find you or reach out to you, how would they do that?
They go straight to nutritionfacts.org. It has all my contact information on there. And so, feel free to reach out anytime with anything I can do to help.
No, that's wonderful. And thank you. And thank you for the tips and the advice and all the different stuff that we spoke about today. And if nobody else has any other questions, I know you have an incredibly busy schedule, and I want you to have a few minutes before your next talk. And Katie
says, can pee!
Which, is important. So Katie says thank you, and to everyone who is watching, thank you so much. Have a great day, Dr. Greger, and enjoy Hawaii.
Keep up the good work.
All right, you too. Bye. Well, everyone, thank you once again for joining us for our live talk with Dr. Greger. And just so you know, thank you to Plant-Based Fans, who's part of the Plant-Based Network, for sponsoring this week's talks. And of course, you can go to virtualvegfest.com and you can shop our vendors and a couple of contests that we have. You can like our Virtual Vegfest Facebook and Instagram pages this month. And on August 31st, we're going to do a contest for you to win a prize pack from Follow Your Heart and Crafters Organic and Sun Warrior. So if you're picked as the winner, they're going to ship you out a really cool prize pack. And if you didn't see the video that we did yesterday with Aaron and Tom with their Follow Your Heart prize pack they got for just subscribing to our YouTube channel, check it out, because they got some really cool stuff from Follow Your Heart, stuff that we don't even have in our stores now. So definitely look at that and like everything. And we will see you on Sunday at 4 p.m. Eastern Daylight Time for our talk with Meredith Marin. And she created this really cool thing in Aruba. So you'll get to meet her. And everyone, have a great rest of your week. And thanks for joining us and liking us. Bye.